This is recording. We're live.
Welcome. The last year has seen amazing innovation within the healthcare industry as we've had to develop new solutions to address the growing challenges of COVID. Entrepreneurs were on the forefront of that change, partnering with business leaders to make healthcare more accessible and safety more effective for more patients than ever before. Healthcare entrepreneurs have used the last 16 months to prove that they can make a huge impact in their communities from coast to coast. We've been honored to help a record number of healthcare companies this year through our Project Healthcare program, connecting entrepreneurs with the relationships they need to put life-saving devices and services in motion. That's 31 amazing teams from across the US. And in fact, one of them, Darvis, most recently announced they'll be moving their headquarters from San Francisco to Nashville. And we're thrilled to welcome them, as well as many of you here today. Before we get started on today's event, I want to extend a thanks to the behind-the-scenes heroes of the Pitch for Good events, the selection committee, who narrows dozens of applications down to only 6 entrepreneurs you'll see pitching today, and to our judges. Thank you for giving your time. None of this would be possible without the support of our sponsors. Thank you, Ewing Marion Kauffman Foundation, GP Sources, Dell Technologies, and Launch Tennessee for your incredible support. Now, let's get started. Take it away, Bryn.
Good afternoon, everyone. I'm excited to see you all here. Thank you, John, for getting us going. I'm excited because 1, healthcare is the #1 industry in Nashville, as you all know. And then 2, because this happens to fall in a really exciting time in our own programming when we are in the midst of Project Healthcare selections and admissions. So Jeremy will talk about that a little bit later on, but know that this is at the heart of what matters to us at the Nashville Entrepreneur Center and is a huge part of the destiny of Nashville. My name is Bryn Plummer. I'm your host today, and I'm the Vice President of Inclusion, Equity, and Community for the Nashville Entrepreneur Center. And I'm glad to be with you all. And as John mentioned, I lead a program, sorry, John did not mention this, but I also lead a program at the Nashville Entrepreneur Center called Twin Day for entrepreneurs of color who are scaling their businesses, and Pre-Flight, which is the business course, 14-week course that helps you know if your business is ready to get off the ground. So as you can see, we serve entrepreneurs all across the spectrum. With that, let's get into a bit of housekeeping. As this is a webinar, you know that your video will not be on and you will not be able to come off mute if you are on as an attendee. But if you have questions, if you have comments, if you have something you want to share, the chat is the place to do it. And as you can see, people are already going to be in the chat from our teammates here, some who are chatting away right now, including the mayor, the informal mayor of Nashville, Clark Buckner. This is a great place to give shout outs as well. So when someone finishes a pitch, it's so exciting to go in when they're done and they take a breath to see all the positive affirmations in the chat. Second, this event is being recorded. We want to share it in all its glory afterwards. And if you go to our YouTube channel, you search on YouTube for Nashville Entrepreneur Center, you can see all the past Pitch for Good events. And then 3, I want to cover what an elevator pitch is, because that's what you're going to see today, if you've never heard that word before. So let's imagine for a second that you get on an elevator with a really exciting entrepreneur, someone who is successful, maybe has the potential to get your dream off the ground. And you have from floor 1 to floor 20 to try to convince this person that your idea is the one to invest in. That is an elevator pitch. No slides, no gimmicks, no amazing sales deck. You really just want to convince that person based on who you are and the great idea that you have to show and present to them. That is what we're here to do today. And we will do it in a really tight hour. So I'll keep the agenda going, and Jeremy on the back end will also keep the agenda going. With that, I want to make sure we get an opportunity to meet our phenomenal judges. As John mentioned, they are a huge part of this event today. So first, we've got Dan Rumley from Dell's design team. Dan, great to have you. Then we've got Zach Todd, who's the general manager of GP Sources. We're very glad to have you, Zach. And GP Sources is a business that has been really helpful to a lot of our entrepreneurs in the packaging, shipping space. We're glad to see you again, GP Sources. And then we've got Dr. Jacqueline Shribata, who is the clinical lead for consumer health at Google Health. And then Saurabh Sinha, who is a part of the Nashville healthcare ecosystem and has been for some time, was the founder and CEO of eMIDS. And he's also a part of the Nashville Entrepreneur Center family as being a member of the McWhorter Circle and someone that we are really excited to be able to partner many of our entrepreneurs with for guidance and advice as they grow their businesses. So thank you to our judges for being here. We'll get to hear from them a lot more once we get to the pitches. So here's how the pitch flow will work. We've got 6 pitches today, and each entrepreneur will have 1 minute to pitch their concept. Then we'll have 2 minutes for Q&A from judges. That's where we'll hear a lot of those judges come off mute, ask their questions, try to understand more about the business model and how the business works. And then finally, we will have an audience vote at the end. So our judges will pick 2 winners today, and then you will get to pick a winner as well. All right, Jeremy, I think we're about good to go. Oh yes, last thing, prizes. I'm sure that's super exciting and part of why many of you might be here. Sorry, excuse me, let me take that back. We are able to offer financial grants to the people that win Pitch for Good. And we do so because of the support of our sponsors and the support of the sponsors of this event in particular, who are able to make that possible. Cash is king, especially during uncertain times for entrepreneurs. So for the 2 winners today, they will each win a $2,000 financial grant. And then the crowd favorite will win a scholarship to a partial scholarship to EC programming. And as you know, getting connected to the curriculum and coaching and support of the EC can be a catalyst for entrepreneurial success. So we're excited for that winner as well. All right, take a breath. Now we're going to hand it off to our entrepreneurs. We've got 6 companies today who will be presenting their pitches: Caring Wire, Fast Asleep, Magnolia Family Medicine, Major Care, Potty Cap, and Yumlish. Many of these entrepreneurs are part of Nashville Entrepreneur Center programming, but some of them aren't. They are entrepreneurs who, for the most part, call Tennessee home, many of them Nashville in particular. So we are excited to see what they have to offer. We've got everything from healthcare administration apps and nutrition apps to medical devices, which we see a little bit less of here in Nashville, but plenty of throughout the rest of the state of Tennessee. So with that, let's get going. Jeremy, let's see our first entrepreneur.
Is that me?
I think it
You're
could
up,
be.
Michael.
Perfect. All right, Michael, you ready? The camera's on you.
Ready to go.
All right, Michael of Caring Wire, take it away.
All right. Did you know there are 50 million family caregivers in the United States, providing $500 billion worth of unpaid care? My passion for this space grew out of personal experience. I watched my mother struggle under the stress and burden of caring for her aging parents. And like 15% of Americans, my mom took an early retirement as a result of the stress. Caregiving causes inequity, poor health outcomes, and perpetuates the poverty cycle. And this is why we created Caring Wire, a digital caregiver assistant that uses conversational AI to understand an individual's needs and make personalized recommendations that enable the home to become the hub of healthcare. You can think about it like this. We embed ourselves in the decision-making process of families to become the Google Maps for family caregivers. We sell our SaaS software to businesses, including health plans, providers, and employers. So vote for Caring Wire so we can enhance our database of resources and create the yellow brick road for caregivers. Thank you.
Michael, thank you so much. I think that's huge, especially as we think about our aging population in the US and the rise of millennial caregivers among boomer parents. So this is huge and something that's going to be even more prescient as we grow as a society. So thank you for sharing it. Thank you for building it. And I will give our judges 2 minutes to ask questions. I will give a 30-second warning in the chat. And with that, I hand it off to our judges. Any judge who would like to begin may begin with their questions for Michael.
I have a question for Michael. Could you give me an example of the user journey and what's a good outcome that would be as a result of Caring Wire?
Yeah. So, really our focus is on the social determinants of health, so the non-clinical aspects of care. So an example would be you get discharged from a hospital, you have your standard post-acute process where you might go to a skilled nursing facility or home or engage in home health, and then you're on your own. So a caregiver might engage Caring Wire to understand what to expect in that first 30, 60, 90-day period and engage in services like home care to augment the home health, transportation, and food delivery. Some good outcomes that we're looking for is engagement, stress reduction, and really the confidence in their caregiving responsibility and confidence in the future, kind of optimism of that they know what to expect and how they're prepared. Any other questions?
Hey, Michael, this is Zach. Hey, good job on the pitch. One question I had, it sounds like the end user of the product is the family unit, the caregiver, but you mentioned your sales model is more to the business provider side. So can you walk me through that relationship and how that rolls out into the market?
Yeah, so we are not direct to consumer today because the challenge is caregivers don't self-identify as caregivers, they're sons and their daughters. And so we target complementary channels like providers, health plans, and employers that have a captive audience and a vested interest in their members or their employees' lives. And so we sell directly a SaaS-based model to those entities, and they roll it out either by bundling it into their existing services or by setting it up as like a voluntary benefit in their employee assistance program.
All right, Michael, thank you. Thank you so much. This is something that's very timely, important, and also love your background. What a beautiful little background.
My wife.
Oh, well, tell her kudos. This beautiful interior design. Thank you so much, Michael. And it's sometimes hard to be the first person to kick it off. So make sure you give Michael some love in the chat for being the first to begin. Up next, we've got Reed Wiley of Fast Asleep. Reed, are you out there?
Hey, thanks, Brent. I'm here.
Beautiful. All right, Reed, I'm going to hand it over to you.
All right. Each year in the US, over 1 million patients require general anesthesia and nasal intubation for their dental work. Our co-founder, Dr. Matthew Yezierski, realized during his anesthesia training years that there was no convenient and reliable way to wrap and protect the head and eyes of patients during nasal intubation. Each provider was using their best efforts and a variety of tape, towel, and gauze in order to wrap the head. This resulted in time and money wasted. Studies have shown that OR time can cost $50 or more per minute, and head wraps can last 3 minutes or more and produce sloppy results. This is why we have produced the Fast Asleep patented safety patient product. This product allows us to provide a safe and reliable way to protect patients during their nasal intubation. This streamlines the process to under 30 seconds and saves ORs and patients hundreds of dollars. If we were selected, we would use the grant to help us complete our FDA clearance. I want to thank you so much for your time today and would love to answer any questions you may have.
Reed, thank you so much. I love how niche this is and yet how universal it is. It's such a specific moment and short moment in the care cycle, but clearly it needs work and needs innovation in ways that could really improve the patient experience and patient outcomes. Really great, really grateful to see this and to learn about this issue that I didn't really know existed. So thank you. And with that, we've got 2 minutes for our judges to ask you questions. Judges, you may begin.
Hey, Reed, good job. Thanks for being here today. As you're evaluating kind of the comparison to your product to what's on the market today and pricing that, how does that comparison work from a pricing costing standpoint? And then what data are you using to show the ROI to the provider, the healthcare system, of using your product versus the old way?
Sure, of course. Well, we first of all are a brand new product, and we're using it in our practice, but it's not in other practices yet. And so we do have to capture that data from providers to know, hey, how much are they using in consumables each time? How much time is that really costing them? But when the people that we've talked to, the providers we've talked to, and our own experience, it is taking that 3 minutes or more every time, and just a hodgepodge of materials that adds up over time, and not being able to reproduce the same type of experience every time too, where an anesthesia provider may produce one outcome one time, but then the next time there's a different provider that has a completely different experience for the surgeon that's performing the work. So those are the things that we're looking at, and we would definitely need to know the cost that companies are incurring for those consumables.
We have time for one more question.
Hey, I'll go. Reed, awesome pitch. What's your thinking on the sales model? Is it direct to your client, or you plan to do this through resellers? I expect that you'll have a very large base to sell to. So how are you thinking about that?
Our initial thoughts are not to do a direct sales model to providers, but potentially a licensing opportunity or consignment to people that are already selling into the anesthesia space for providers in ORs and surgery centers.
Got it. Thanks.
All right, Reed, thank you so much. Thank you for eliminating this issue. And also, I feel like many of us probably don't think that much about the hospital unless you're in healthcare every day and think about hospitals every day. But this is something that many of us will likely experience in our lifetimes at some point. So thank you for bringing attention to it and for building something around it. Thank you for being here. Good. Thank you for being here, Reed. All right. That is Fast Asleep. We're on to our next one. Jeremy and I were just commenting on how we are cruising through these pitches today because these entrepreneurs are extremely well prepared. With that, we're reaching our third pitch of the day. Dr. Kim Moyer of Magnolia Family Medicine. Dr. Moyer, are you out there?
I'm here. Can you hear me?
I can
Okay.
Indeed.
Great.
And the floor is yours.
All right. Thank you. Hi, I'm Dr. Moyer. I am the physician and owner at Magnolia Family Medicine. I opened my practice with the intention to create more affordable, more accessible, and hassle-free primary care. We are the only practice in town that doesn't have a waiting room. We offer face value upfront pricing, and every patient has my cell phone number in the event that they have an urgent issue after hours or just a quick question during the day. When you show up for your appointment here, you're not greeted with name and date of birth, please. You're greeted by your physician at the door, and you're walked immediately back to the exam room to get started. I can do these things because I have eliminated third-party industries from my practice. I do not have a large corporate overhead, and I do not bill health insurance. I contract directly with my patients on a low monthly membership fee, and we reserve their health insurance for catastrophic illnesses that require surgeries or hospitalizations. Under this model, annual labs become $10 versus $200. Prescriptions are $6 less on average, and procedures are never more than $25. I'm Dr. Moyer. Thank you so much for listening.
Thank you, Dr. Moyer. Thank you so, so much. And also, I'm just marveling at this idea of having my doctor's cell phone number. That's it sort of blows me away. All right, judges, it is your opportunity to ask questions of Dr. Moyer about Magnolia Family Medicine.
Dr. Moyer, great pitch. How do you engage with specialists as in terms of both electronic medical records and other types of communication?
Yes, so I still have an electronic medical record, and it works the same as any other primary care doctor. So I fax over records. One of the great things about direct primary care is because I'm not carrying a patient panel of about 2,000 patients, which is average for a family physician, my panel is a lot smaller, which gives me the time to communicate with these specialists a little bit better, in my opinion. I can pick up the phone, I can call them, I can get their thoughts. Outside of that, just a little bit of extra time, it works the same way.
Hey, Dr. Moyer, this is great. What kind of patients are you attracting? Is there a particular demographic, or how are you thinking about that?
That's a great question. My practice model works for everybody for different reasons. Okay, so I'll get an uninsured patient because they don't have health insurance, but yet they want a family doctor in their court. And so they can afford a $75 a month membership fee where they can't afford health insurance. And that's all that they can get. It also attracts people that have high deductible plans where they go to their primary care and they're paying out of pocket anyway for expensive appointments, expensive medications, procedures, because they haven't met their deductible. So when you take your insurance out of the equation, just like your tire rotations and your oil changes, like your car insurance, prices come way down in primary care when you pay out of pocket for your routine maintenance.
Got it. I have one quick follow-up question. Do you ever plan to get into any contracts with insurers at all to expand?
I do not. I do not. What I do is so affordable for patients. Like I said, joint injections, skin tag removals, different procedures. I usually can only charge patients $25 or less for any procedure that they would have done here. And that's way better than what can be done in a traditional conventional clinic with insurance billing.
Got it. Thank you, Dr. Moyer.
You're welcome.
Super fascinating. Thank you for those questions, our judges. And it sounds like it's also provoking this. For me, when I hear you describe what you're doing at Magnolia Family Medicine, it does make me kind of reimagine what healthcare might look like and feel like, and the experience could be like, and like going back to the old school country doctor,
Yes.
in a way that I think is exciting for many of us who've been in healthcare for a long time. So thank you, Dr. Moyer, for being on. And with that, we are at the halfway point of all of our pitches. So here we go. 3 down, 3 to go. Up next is Mandy Major of Major Care. Mandy, do we have you on?
We do. Can you hear me?
I can
We're
indeed.
good.
All right.
Halfway through, water break.
Rick, everyone take a little beat. Mandy, the floor is completely yours.
Awesome. All right. Well, hi, I'm Mandy Majors, CEO and founder of Major Care. We are a team of doulas and doctors on a mission to solve a crisis that is hiding in plain sight, which is our lack of standardized postpartum care. We're the only developed country without it, and frankly, it shows. We are in a free fall with a $14 billion problem that has OBs drowning in postpartum calls that they're not necessarily trained to take, new moms overusing the ER for basic lactation questions, massive equity gaps in maternal health outcomes, and rising untreated postpartum mental health needs that create costly worst case scenarios for employers and insurers. Doctors alone cannot solve this. And that is why we created the My4th app. My4th is a 4th trimester postpartum care management solution, which blends daily evidence-based guided learning with virtual doula and lactation care. We've had early interest from payers, but we need funding to build out our app and scale our team in order to secure those essential pilots with healthcare groups and insurers to prove what we know. With an educated, safe, and empowered postpartum, everyone benefits. Thank you so much.
Thank you, Mandy. Thank you so much. And I don't think it could be overstated what a huge issue this is. And if we were to solve some of these postpartum, and I love the idea of calling it the 4th trimester, if we were to solve some of these things, I imagine the health outcomes for birthing people in the US would just dramatically skyrocket. So thank you for doing this work. And I know that it's really challenging and invigorating work. So thank you for doing it day in and day out. All right, everyone, that is Major Care. We're going to give her 2 minutes to take questions from judges. All right, Mandy, judges, have at it.
Mandy, great pitch. Is your program a combination of chatbot and coaching? Is it just coaching? I'd love to know a little bit more about the product.
Yep, absolutely. So we take you day by day through your postpartum journey. So every day you have that guided learning component with a video, tips on what's normal, what's not, what you might be feeling, and resources. And layered into that are sessions available with lactation experts and doulas. And in a future iteration, we'll be moving into a chat feature, 24/7 chat feature, as well as some proactive remote monitoring. We have a wellness tracker that's built in using emojis to gauge how you're feeling every day in terms of your emotional health and your physical recovery. So right now that's really a self-assessment, and in the future that'll be tied into a remote monitoring system to trigger proactive outreach from a care coordinator.
Hey, Mandy, this is a great space. One question is, I know you're not yet gone to market, but how are you thinking about that in terms of are you going to go direct to the consumer? Are you going to go to other entities? What are your thoughts on that?
Right. So we currently have a beta that is live and with consumers. So we're really focused on product market fit, and we've heard a resounding yes in terms of how we're reaching folks day by day. So what our future goal is to be aligned in the B2B2C space, so that you are hearing about us through your care provider. It's backed by insurance, and within the last month of your pregnancy, you're not walking out of there without our postcard with a QR code to download to make sure we're in your back pocket from day one.
Got it. Thanks.
How does the app fit into the current ecosystem of that provider to patient? Like, is it complementary? Is it a brand new service that they're adding to kind of their tool belt, or is it complementary to their current offering?
We would see right now it's a proprietary product. We would have it be co-branded. Say if we're working with a United Healthcare, we know you're in that experience and able to have that fully covered by your insurance. Does that answer your question?
It does. Thank you.
Okay.
Thank you for those questions. Thank you for that question, Zach. That was actually a question that I was wondering about too. All right, Mandy, thank you so much for bringing this attention to this issue. And also, I know there's a massive explosion of COVID babies out there. So I imagine there's a lot of people out there who desperately need what you're doing. So thank you.
Thank you so much.
Thank you. And then we've got Faye Pryor of PottyCap, one of our medical devices in the lineup today. Faye, let's see if we've got Faye in the mix. Faye, are you out there? We can always come back to you, Faye.
So Jeremy here, there was like 3 separate people named Pryor in the thing, but none of them said Faye. And so I can't tell if Faye is using someone else's account. But what we'll do is we will go ahead to Shireen.
Perfect.
Of Yumlish, and Faye, if you could message me through the chat and tell me which account you're using, I will get you up on stage next. Because right now there is a Pryor on stage, but I guess it's not Faye.
Yes, Faye, we want you. We need PottyCap to get on the stage, but we'll put you in the dugout and we'll go ahead to Shireen to hear about Yumlish. All right, Shireen, I know you're on the ready, so I'm sure you're ready for this, but Shireen, we're gonna elevate you to bring you on as a panelist so we can see your video and hear your voice. Okay, Jeremy is handling that. Are you there?
Yes, I'm here. Can you see me and hear me okay?
I can see you and hear you perfectly. Wonderful. All right, Shireen. All right, Shireen Abdullah of Yumlish, which is a different, I feel like, well, let me not give it away. This is a different industry that we've heard about today and a huge industry that is ripe for disruption. Take it away.
Thank you so much, Bryn. All right. Carla is of Mexican origin, a mom of 2 kids, gets a type 2 diabetes diagnosis, and the best advice her physician can provide to her is to, quote, eat healthy. There's a gap in diabetes management in that they're largely focused on connected devices, but are not addressing nutrition in a meaningful way for Carla. Yumlish provides culturally adapted nutrition therapy focused on Latinos with diabetes and pairs that with addressing socioeconomic and behavioral barriers to dietary adherence. Ultimately, our differentiator is a culturally relevant, low-cost program with low barriers to adoption, translating to 12.5 virtual touchpoints per person per week. Using reimbursable encounters alone for us, this is a billion-dollar market opportunity with opportunities to grow in population health, managed care. We have relationships with health systems, clinics, school districts in Texas with a revenue potential, in fact, of $20 million right there. We're seeking strategic investors for our current round. The ADA just awarded us $250,000. So vote for us and join us on our mission so that Carla gets the care that she deserves. Thank you.
Well, congratulations on that award. That is a huge, critical time to get that sort of investment. So thank you for doing it. Clearly, the ADA recognizes this is huge. And there's something about the culturally specific and culturally relevant coaching that is, I think, a huge, just a very untapped world within the world of dietetics and nutrition. So really excited to see this come to market. With that, judges, it's your turn to ask Shireen Abdullah questions about Yumlish. And I will let you take it away. I will start the clock.
Hi, Shireen, great pitch. I was curious about the source of the content. Who's writing the content and how is it validated?
Lovely. Great question, Dr. Sherbaidi. So what we're doing is we're using content from, so what we did is we started with content from the CDC and the American Diabetes Association. So they have sort of these standard, and you can imagine it's not culturally relevant at all. It's just generic sort of curriculum that they have out there. And we started with that evidence-based curriculum, and we modified it to be culturally relevant for our target population. In fact, after quite a bit of back and forth, we actually have both of our curriculums, diabetes prevention and diabetes management, approved by the CDC and the ADA.
Hey, Shireen, very, very interesting space. How will you keep track of outcomes and sort of create that excellence loop of getting better and better?
Yes, so it comes with a combination of providing the culturally adapted nutrition therapy, also addressing some of the socioeconomic things. What we are doing is sort of working with different partners. So I'll tell you on the socioeconomic side, for instance, we're looking at partnerships with Aunt Bertha and Unite Us and some of those other solutions that exist out there to close those loops. But at the end of the day, when we're working with, especially with providers, we're able to exchange data. So we provide to them sort of the weight data, they provide to us A1Cs and how those are looking. So there's this continuous feedback loop that we share with our partners.
Okay, got it. Thanks.
Yeah. In fact, just a quick note on that, Dr. Sherbaidi, you may find this interesting. We're looking at specifically cardiovascular care as well, and sort of looking at that comorbidity between cardiovascular care and diabetes to sort of track outcomes over a longer period of time in a trial. So just want to put that out there.
That's fantastic.
Last question. This is just for me. I'm curious. Shireen, what does the interface look like? What are you kind of prioritizing in the interface and design for the UX in your design?
Thank you so much for asking that. So the best part about our solution is that we're offering everything over chat and web-based. And that has been very conscious because the population that we're targeting is not tech savvy. And so for their needs, and there's the points of establishing trust that is needed even before care is delivered. So in doing that, we're utilizing apps that are already on their phones and they don't need to download new apps, and we're going to push them to log on to another app that they either don't trust or don't know how to use.
That's awesome. That's really specific and special. That is really specific and especially important for this community. So thank you so much. And also for anyone who's out there listening, I hope that you can see a little bit about how someone like Shireen, who's an entrepreneur, is thinking about the user when they're making their products and designing. So super critical. And we have a huge population of Latinx and Hispanic Americans in Nashville. So if you're someone who knows that community and knows intimately the issues that are facing that community, I'm sure there's lots of innovations we need right here in town too. All right, Shireen, thank you so much.
Thank you all.
Jeremy here really quick. We got Faye, she's on. Just a reminder to the judges that we swapped the last two. So when you're doing your judging form, make sure that for Shireen, she's the last one on the form, and then Faye will be here. That's me.
Thank you, Jeremy. Shout out to Jeremy. He is the executive producer of Pitch for Good. He's behind the scenes making a million things happen all the time. And so thank you, Jeremy, for doing that. And then Faye, we are ready for you.
Okay.
Beautiful. There she is. All right. Okay, Faye, your minute is here. Take it away.
Incontinence is the leading cause of falls in acute care. This is a $30 billion a year problem. Solutions for women include bed pants, catheters, and diapers. For men, usually urinals. Women report urinals are messy and difficult to use until now. I'm Faye Pryor, PT and creator of the Potty Cap. The Potty Cap is a urinal for women to use when they can't get to the bathroom. It's designed for the way women normally urinate. It can be used from the bedside, from the wheelchair, or any seated surface. Potty Cap can assist in decreasing healthcare costs and improve patient care. Nursing states it saves time and increases patient safety. A patient summed it up. Potty Cap saved my life. I have peace of mind because I'm independent again with my toileting. This fund will be used for manufacturing. Let's make Potty Cap a win-win for healthcare. Thank you.
Thank you, Faye. Thank you so much. And I remember hearing you pitch previously and just thinking about how little I knew that this was a problem and just had not experienced it. And also how blown away I was, but there was not already a solution on the market for this. It's just kind of staggering. So thank you for being a trailblazer in that regard, because this is clearly going to impact a lot of people in their care. All right, with that, 2 minutes for our judges to ask questions of Faye about Potty Cap.
Thanks, Faye. Good pitch. Can you walk us through kind of where you are in your product development life cycle? Are you through, it looks like you have prototypes. Are you through prototyping, getting to mass manufacturing, mass production? And how does that lead to more scalable growth?
Hopefully we are complete with the prototypes after dozens of changes. And we are now in the process of manufacturing. So yes, this is where our next step is actually manufacturing.
Hey, Faye, very, very good space. How are you thinking about selling this? And what are your market segments?
You know, this is twofold because once we started, I'm a rehab director in a long-term care facility. And a patient told me that she was tired of using the bedpan to urinate. And I said, well, there are urinals out there. And she says, where are they? And when I investigated, they look more like male urinals. And so we've decided that long-term care, of course, will be one of the industries. But since that time, we've looked at acute care, assisted living. Even women in the homes are asking for this. So it's a wide range of women with incontinent care. Is one of those closet secrets that they don't want people to know about, but they have a problem. So initially, we're going to look at it from a one-to-one, but we're hoping to go into hospitals, assisted livings, and nursing homes.
Excellent, excellent. Thanks.
We've got time for one more question.
Did the original potty cap look this way, or what types of evolution has been in the design?
Okay, the same woman that told me I needed to make a urinal, a man walked into her room with a baseball cap. I went to my office, got a baseball cap, I gave it to her, and I said, if you had to use the bathroom, how would you use it? She showed me how she would use it with a baseball cap, and we made the potty cap.
Mm-hmm.
I find that absolutely staggering to even think about, but it makes total sense when I look at the final prototype and where it began. So yeah, good origin story. I like the idea of having an origin story for a female urinal. All right, Faye, this is huge and something that I think a lot of people will need at some point in their lives. And I think we've discussed before in the previous pitch how this has implications too for campers, hikers, lots of people beyond those who are bedridden, and also for lots of different people in many different stages of their lives and in the life cycle. So I'm really excited to see where you go with this. I know you're just beginning this process and this journey, so super excited to see where you go.
Thank you.
And thank you, and thank you for bringing us home. I feel like we've rounded the corner on all of these pitches. So please give it up for the 6 entrepreneurs who have pitched today. You can give it up in the chat. Really excited to see these 6. Again, CaringWire, thinking about being that hub for family care and generational care. Fast Asleep, the device that is going to assist with nasal intubation in hospitals and make that a much more standardized process and much less expensive, costly, time-consuming process. Magnolia Family Medicine, who is remaking the way that we do family care and family medicine care by having a more personal relationship and also a completely insurance-free medical relationship. And then Major Care, that is focused on that 4th trimester of pregnancy, supporting women and birthing people in the postpartum space. Potty Cap, actually I'll flip it. Yumlish with Serena Abdullah, that is focused on diabetes care and diabetes management within the Latinx population. And then finally Potty Cap, which is again, the female urinal that is trying to make sure that anyone who is bedridden or anyone who does not have access to the traditional toilet situation is able to take care of themselves, no matter their anatomy. All right, so this is an interesting part of the Pitch for Good. This is when there's a lot of behind the scenes activity going on. So first, you should see an audience vote pop up on your screen that will enable you to choose your favorite here in the pitch competition. So this is where the crowd, the audience, gets an opportunity to put their voice out there. This is also when our back-end team will be tallying all the votes from judges. So right now, our judges are working to put their scores in for each of these 6 entrepreneurs. So as they do that, we will populate those scores and determine a 1st and 2nd place winner. And as a reminder, 1st and 2nd place winners today will receive a $2,000 cash grant. And that will enable them to do, as they mentioned in their pitches, various things from obtaining their patent and moving forward in their patent processes to figuring out their go-to-market and also to develop and continue to develop their manufacturing processes. So we are really excited for that. This is also a great time for us to, again, acknowledge the sponsors that make this possible. This is something, the Pitch for Good series began in COVID as a way to highlight all the different innovations and entrepreneurialism that was going on across Tennessee in a really dark time for many people in small businesses and startups and just people in general. But it was a way to shine a light and to create hope for entrepreneurs and for prospective entrepreneurs and people in the community who benefit from their unique innovations. And one of the institutions that is doing that really at scale across the United States, the Ewing Marion Kauffman Foundation. They are particularly interested in thinking about entrepreneurship within kind of off the coasts of the United States. So thinking about how does entrepreneurship, small business development, startup enterprise, how does that impact a community? How does that help place make a community? And in Nashville in particular, we have a really, really high percentage of people who are hyper-local consumers. We are people who love to buy from Nashville. We love to support Nashville. We love to support Tennessee startups. So the Ewing Marion Kauffman Foundation is a natural partner to us, and we are thankful to them. Also, that Philip Gaskin, their VP of Entrepreneurship, who oversees Kauffman's national strategy, is really focused on eliminating systemic barriers to entrepreneurship and enhancing economic activity through inclusive entrepreneurship, which is super key to the Nashville Entrepreneur Center strategy over the long term and a big part of who we are as this entrepreneurial hub. Then up next, we've got GP Sources. And as I mentioned at the top of the show, GP Sources is a company here in Tennessee that is really supportive to many of our entrepreneurs who have been trying to figure out how do we package our goods, how do we make our goods something that can ship safely and sustainably and in a way that is reflective and representative of our brand. They worked really closely with one of our entrepreneurs last year, actually the ultimate winner of the Pitch for Good series, CPR Wrap, who has developed a sheet that goes over the body to enable someone to deliver CPR with a lot more confidence and a lot more success. And they now have a child and adult version. And I believe they're in process of developing a dog version of CPR Wrap. Do we have time, Jeremy, just to talk to Zach for a second? I don't know if we have a little bit of time.
I actually just brought up Kristen.
Oh, Kristen's here? Okay, perfect. Kristen, are you out there?
Hi, Bryn. How are you?
Good. How are you doing?
I'm doing great. I absolutely love you and being the MC. It's so fun and exciting. And also congratulations to all the panelists. There were a lot of great pitches. So the judges have their work cut out for them.
They really, really do. They really do. I freak out and geek out on all the pitches as they're going to, even though I know some of these companies, I get so excited to see them pitch because it's different being in a session or a Zoom workshop with them versus seeing them on, it's just a completely different experience.
Absolutely.
So do you want to tell our audience a little bit about GP Sources and kind of bring them in on what you all do?
Yes, so GP Sources is a product development company. We do sourcing, manufacturing, and importing as well. And we help entrepreneurs take their product from concept to creation and to market. And a lot of people don't know, specifically in relation to the healthcare industry, that we are a registered FDA medical device facility. We've navigated the FDA compliance and device listing registration process for clients. So we have several healthcare product clients and partners, as well as being a volume provider for PPE during the 2020 COVID pandemic. And we've partnered with several local large healthcare providers and also have donated a large portion of PPE to help local healthcare facilities to ensure that their workers were safe during the pandemic. So
huge. And one of those things, and also it's so interesting to even hear you say PPE pandemic, because it feels like we're out of that. But the truth is there are still many people across the United States are still actively fighting this. So thank you for continuing to do that work and to enable the safety of our healthcare workers, because we are still in the midst of that pandemic, even though many of us fortunately are on the other side of vaccines. So thank you so much for doing that. And is there a way that people can get in touch with GP Sources if they're interested in figuring out their manufacturing or, trying to understand how they can move forward in their product development and design?
You can go to gpsources.com and find us. And my email is kristen@gpsources.com if you have any questions or just want to circle up with us, and we're always happy to help.
That's fantastic. Thank you so much. Thank you so much, Kristen. And thank you, GP Sources and Zach, for judging today. We appreciate you guys so much. All right, Kristen. Up next, I just want to spotlight a couple more sponsors. Dell Technologies. I know that Jeremy says there's a very slick and beautiful video that should be coming our way from Dell Technologies.
Hey Cortana, open my calendar.
Beautiful. And Dell is the provider of all of our technology at the EC. And thank goodness for that, because some of us, like Jeremy, are double screen kings and queens and need our little double screens. I'm using a Dell right now to process. And I have to say, I was a Mac user for a long time, and this processing speed on this Dell is a bajillion times better than my Apple, my little Mac. So thank you so much to Dell. And I know we've got Marcus Devane here to talk with us just a little bit. Marcus, are you on? Jeremy, were you able to bring Marcus to the stage?
Yeah, can you hear me?
I can indeed. Oh, Marcus, loving that background, my friend.
Oh, thank you. It took some time to find something that I can.
Well, it feels very, city life. Yeah, you're looking like a cool guy. I gotta say, you're looking like a cool bachelor about town. You're probably at a happy hour on a rooftop somewhere.
That's exactly where I'm at. No.
And I know, Marcus, you're with Dell for Entrepreneurs and helping people figure out exactly how they can deploy Dell technologies to help them thrive and grow their startups. So do you want to tell us a little bit about that?
Yeah, super excited. This is a new initiative for Dell, because when people first think about Dell, they think big business and we help larger, but we have a department that's catered to small business, entrepreneurs, startups. So the part that we're talking about today, and Dan is actually on that team, is OEM Solutions. We found that this is a very, very interesting play for startups. If you have a software or you have an app or an idea and it needs to go on a custom box or it needs to go on a system and you don't have a manufacturing capabilities, we can help with that. There's no job too big or too small. If you think it's something, get in touch with me. We can do everything from you change the size of the box to fit in a kiosk. With your software on it. We can dip it in yellow paint. If your company logo is yellow, we can slap it on the front of it, ship it straight out to the customer. So it looks like it's coming straight from you. So it's a great way for to go to market, and we can definitely help with that.
I love that. Could you just say what OEM stands for real quick?
OEM, actually, what does OEM stand for? It's actually Design Solutions.
Okay, good. I was like, I don't know what OEM. Okay, good. I was like, I don't know what OEM stands for. I will out myself as the person who's new to many of the initialisms of technology. So we'll find out. Maybe Daniel tell us.
Original Marcus, equipment manufacturer.
There you go.
Perfect. Okay, that
Dell is all about acronyms.
Yeah.
Everything's acronyms.
Truly, truly. Original equipment manufacturer, which makes sense, right? You're thinking about making this technology specialized for the company and shipping it out in a way that feels it's almost like white labeling sort of for that company. In some ways, it sounds like.
Yeah.
And Marcus has put his email in the chat. Please be in touch with Marcus, marcus@devane@dell.com. He's actually our representative who we talk to most often with our entrepreneurs here at the National Entrepreneur Center. So thank you, Marcus, coming to us live from the rooftop. Rooftop. And please do be in touch with Marcus. He's super helpful and someone who's been of tremendous help to many of our entrepreneurs. All right, Marcus, we'll see you soon. And then finally, our last sponsor today, Launch Tennessee. Jeremy, would you like to start with a video or should we talk to Launch Tennessee representative first? What do you think?
So there's not going to be a Launch Tennessee person, but they just announced 3686, their annual conference. It's coming back in person in September, so they have a little sizzle reel to show.
Beautiful. So excited for 3686 to come back. Okay, I'll zip it. Let's see it. If you've never been to 3686, I can't say enough good things about what it is like to be there. It is a place where you can go and get so many ideas. It's sort of like a South by Southwest for the Southeast. so South by Southeast. And it is something that really can't be replicated in any other way. It is coming back in person. It's going to take place all throughout Nashville. And it is where some of the greatest minds in entrepreneurship come together to really think about what it means to place make and make Nashville and make Tennessee the most supportive state to startups, which is what they're trying to do through Launch Tennessee. All right, Jeremy, is it time?
So if you can chat just briefly with
we're still calculating.
the
Okay,
other
perfect.
judges that we haven't.
Okay, I had a couple
we
people
have
that
it,
wanted to
but
talk
I
to.
just we have it, but I just want to hear from the other judges just a little bit.
Okay, I do too. Okay. Also, it just builds the suspense and tension. Guys, I have a little bit of my tongue is a little ticked up today. So I'm trying to work on it. Jeremy's so smooth. It's balancing me out. It's helping so much. Normally I'm a smooth talker, but something is going on today. So please hang in there with me. I did want to talk to Dr. Jacqueline Shabadi of Google Health. Dr. Shabadi, I was interested if you could tell us a little bit more about what you do at Google Health and also what the overall mission is. We're part of the Google for Startups community here at the Nashville Entrepreneur Center, which I'm not sure, I know the alphabet is enormous, so I'm not sure if you have much interface with that part of the alphabet, but we are very embedded in the Google for Startups community, but I would love to know more about Google Health, as that is something that we are trying to get more connected to.
Yeah, it's really nice to meet all of you. It's really been a great opportunity to be here today. Google Health is just a small group of clinicians and other experts in healthcare that are working with Alphabet, which, as you mentioned, is over 100,000 employees. But our group is really providing a health lens, an ethics and safety lens, a health equity lens to any of the products and services and research that's happening at Google. So, the mission of Google is to organize the world's information, make it universally accessible and useful. And we've really put a health lens on that. So if the search team is working on, for example, information on COVID-19, when you type in COVID-19, we're working with the engineers to make sure that that data is authoritative and trustworthy and easy to understand and at a health literacy level that's appropriate for everyone. When AI researchers are working on detection of cancer or some other type of genetic condition, we have bioethicists and other team members working with the engineers to make sure that we're doing it in a fair and considerate way. So we're really very much a horizontal function that spans across the company to really bring academic and clinical and ethical rigor to the roadmap and the existing products that are out in the market.
Wow, and I imagine you have a background as a provider or as a researcher?
Yeah, I'm actually a practicing cardiologist. I still see patients once a week at a federally qualified health center about 10 minutes away from the Google campus. So I'm seeing lots of Medicaid and uninsured patients. And then I have to context switch and go back to work at Google. But I think having an equity lens in mind is really critical for serving the next billion users and making sure that we are being useful for everyone and being considerate of everyone's needs.
Absolutely. I think that's, especially when I think about what we've learned through COVID-19 over the past year, just the dramatic disparities in access, in vaccine access, and outcomes. It feels really timely. And it also makes me, feel really excited and grateful to know that this is a part of Google Health, that there are actual practicing cardiologists on the team. There are bioethicists. There's a tremendous emphasis on making sure that it is an equitable and inclusive health approach that ultimately can serve, as you mentioned, the next billion users, which is billion users is a bananas figure, but I know that Google will get there. So thank you so much for being with us, Dr. Shabadi. And we are so grateful for your questions as well. And to all of our judges for your questions and insights on these 6 companies. And I hope that any of the 6 companies who pitched today will also reach back out to the people that were judging today to find out more about how they perceived your ideas and what insights they have, because obviously we have a deep, deep depth of knowledge among our judges. All right, and with that, it is the exciting time. It is, as you see from the drum roll there, from the little snare drum on your screen, it is time to announce our winners. So Jeremy, let's do this.
All righty. So the first winner of one of the judge awards, which they'll get a $2,000 financial grant provided by the Entrepreneur Center, we have Potty Cap.
Potty
Faye
Cap.
Fryer.
Potty
Yeah, I'm
Cap.
trying to promote her to a panelist to bring her up on stage. Yep, virtual round of applause.
Virtual round of applause for Potty Cap.
Hey, there's Faye. Congratulations.
Congratulations,
No speeches
Faye.
yet, but congratulations. The next individual, the next company that took home the $2,000 financial grant is Yumlish.
Yumlish. Exciting.
Shireen, there you
CEO
are.
and founder
Come on.
Shireen Abdullah.
Thank
Well
Congratulations.
done, Shireen.
Congratulations,
And then
y'all.
the vote was out. You guys decided the crowd favorite through the audience polling. And who do we have for the crowd favorite? But Fast Asleep with Reed Wiley.
Fast to sleep, Reed Wiley. This was
Well
a
done.
hard pitch for good. These were really
know.
phenomenal concepts, and places, and frankly, quite developed concepts in comparison, I think, to some our usual pitch for goods, because we do allow people to enter who are at just the idea stage. So thank you again to our judges who had to make these tough calls to decide who was winning. Thank you to our audience for choosing our winner here, Fast Asleep. And thank you to everyone.
And I'm so sorry,
ahead, Jeremy.
Bryn. I'm
No,
bringing
please,
up
come in.
everyone on stage while we can. We're gonna get a quick picture screenshot. So on the count of three, our marketing team will take a screenshot. So on the count of three, smile, do something goofy. Just let them know who you are through your face. I think that's what they say. So on the count of three, we'll do it in 1, 2, 3. Cool. I think we got it.
I think you nailed it. I think you nailed it.
And while I have the floor, really quickly, I just want to say that applications for Project Healthcare are open. Actually, a few of these teams presenting today are Project Healthcare teams. They close on May 31st, which is this coming Memorial Day at midnight. If you are a founder that's looking for support in the healthcare ecosystem, that's looking for mentorship, connections, and just a community of other health tech founders, this upcoming year is going to be really exciting. We have a new chairman of Project Healthcare, a role filled by Eric Threlkill, who's a former CIO of AmSurge and president of Tennessee HIMSS. We have a lot of great partnerships in the works with entities like Olive Healthcare and working with places like HealthStream. And we're really excited about the upcoming cohort. And so if this is you, if you are a founder that might be looking for support, please consider applying. We'll be following up with that information, but it's on our website as always. So that is it. And I'll kick it back over to Bryn to take us home.
Yes, I can't say enough about Project Healthcare and how it is this accelerant for so many companies that have come to Project Healthcare, and really the entire healthcare industry that has wrapped its arms around the entrepreneurs who are part of Project Healthcare, including the National Healthcare Council, who you see on this slide, who's been a tremendous support to us and partner to us in getting Project Healthcare truly embedded and immersed in the healthcare industry. So thank you to all of our partners in that as well. 12:59. We are becoming a well-oiled machine at running Pitch for Goods, and you entrepreneurs are getting sharper and sharper and sharper, which is making these competitions harder and harder and harder. Thank you to all of the pitching entrepreneurs. Congratulations to the pitching entrepreneurs. Congratulations to our winners. Thank you to our judges. And thank you all of you for watching and tuning in. I think this is something that if you've got an hour once a month, it is probably something that makes you feel an energy and excitement that can carry you through the end of the work week very easily. And I hope everyone has a very safe Memorial Day holiday out there. We will see you next month at Pitch for Good. Bye-bye, everyone. The credits.
My favorite part.
My favorite part. Bye, everyone.
Hey, Shireen, more money, more problems, right? That's what happens when you win.
I'm gonna let you go ahead and rap to it, Jeremy. Go for it.
Yeah, I'm might next time. All right.